Well, President Trump's age at 74 years old could make him more vulnerable to developing severe COVID-19 symptoms.
Information provided by a White House physician in June puts the president in the obese category, which triples his risk of needing hospital treatment.
Well, joining us now is Dr. Ogachika Olozie, chair of the Texas Health and Human Services. Dr. Olozie, thanks so much for joining us tonight.
Thanks for having me.
So, Dr. Olozie, based on today's medical briefing, how concerned should we be about the president's condition?
Well, I think it's really too early, right? We've had a lot of conflicting reports about what the president's condition is. It's great to hear that he's not on oxygen right now. He's receiving remdesivir. He's received a cocktail of monoclonal antibodies from Regeneron. And I think it's really too early. There's multiple ways that this could play out. Obviously, we hope the president gets healthy. We hope he does well. But it's really too soon to make that decision.
And Dr. Olozie, can you tell us why the next 48 hours are so crucial to the president's recovery?
Well, I actually don't agree that the next 48 hours are the critical piece. We've seen this happen in a multitude of patients where they get better over the first 48 to 72 hours, and then a week later, they're readmitted to the hospital. I've had patients that have decompensated in the first 72 hours. And so it's really important to be diligent, especially in a patient that has multiple comorbidities like the president does. Just continue to watch it. I think it's too early to make that call, and we're going to have to see what happens over the days and potentially the weeks ahead.
I'm glad you said that about being more diligent. And so moving ahead with the treatment that the president is currently receiving, can you give us a little bit more detail specifically about what that treatment entails?
Yeah, definitely. So I think if you look at the press release and the statement that was put out by his physician, he's on a cocktail of a host of things, including vitamin D, zinc, aspirin. The real critical things to key in are the remdesivir. That's a drug that has been shown to reduce how sick people get and actually reduce the amount of time they spend in the hospital. One of the things about that, however, is it doesn't actually change mortality, right? The other thing is a new cocktail of what are called monoclonal antibodies from Regeneron, and this is new. It's under a compassionate use. It hasn't gone to phase 3 trials. And so again, this is something that's understandably used for the president of the United States, the most powerful man in the world. And we're really just going to have to watch to see, because these medications have not been used in conjunction together before.
Mm-hmm. And today, the president's doctor was asked by a reporter during the briefing about his condition. He said he's, quote, doing very well. But then the reporter asked if he's doing so well, why bring him to the hospital? You remember early stages of the pandemic, officials said, don't go to the hospital unless you're really, really sick. So what does this mean?
I really think all rules go out the door when you're dealing with the president of the United States. And I think from a medical standpoint, that's very understandable. Some people in the postmark may come back and talk about the ethics of healthcare, sort of VIP healthcare syndrome, but I think it's understandable dealing with the president. Ideally, and usually, somebody without symptoms stays at home and you manage them symptomatically with Tylenol, ibuprofen, stay hydrated. I think, again, in an abundance of caution, he gets access to some of the best care in the world, and I think we would want that for any president.
All right, Dr. Olozie, thank you so much, and thank you for your time and advice tonight.
Thank you. Have a great night.